Good afternoon. Today is Tuesday, December 15th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today for the Oswego County Health Department is Sonia Robinson. To start with today, I'm happy to report that the County Legislature adopted the 2021 county budget last Thursday evening. The budget lowers the generic tax rate from $7.69 to $7.48 per $1,000 of assessed property value, and the overall budget is reduced by $4.7 million from the 2020 budget. Many households and many businesses are still struggling to make ends meet, and we don't know how long it will take for the economy to rebound. When developing the budget, we considered the financial hardships that people are going through and strive to develop a responsible budget that did not raise taxes. I'd like to thank my fellow legislators, County Administrator Phil Church, and all the department heads and employees for their hard work and support in lowering the county property taxes. I would like now to speak briefly about the county's policy of reporting the deaths of residents who have died of COVID. This issue has created some confusion among people who are following the county's COVID statistics. Since the pandemic started, the County Health Department has reported deaths as attributed to COVID-19 after the department receives official verification, such as a coroner's report or death certificate that confirms COVID as the cause of death. As the virus spreads, with more people getting sick and dying, this process has created a backlog in the processing and delivering of these reports. The hospitals, nursing homes, and adult care facilities report deaths directly to the State Department of Health every day. The County Health Department's data is based on death certificates and medical examiners' reports, which we receive from towns and cities and medical examiners. Our process of waiting for death certificates is taking too long in this environment and has resulted in a relatively large and unacceptable discrepancy between our numbers and the numbers reported by New York State. In order to stay true to our desire to be a reliable and credible source of information, we now find the need to become more efficient in verifying and reporting COVID deaths. Therefore, effective today, we are changing our process and will use New York State's data going forward. Understanding that we are still waiting on a number of coroner's reports and death certificates, this will initially result in a relatively large increase in the number we report. To date, we have reported 6 deaths verified by the County Health Department. However, today, the State Health Department is reporting 19 deaths of Oswego County residents. The difference being 13 deaths since the pandemic started that we have not yet received reports or certificates on. The jump from 6 to 19 was not an overnight occurrence. I want to express our condolences to the families and friends of our residents. Every death is a loss to our community. Out of respect for the family's privacy, it is our policy to release no additional information about the patients. Yesterday, the first New York State resident received a COVID vaccine. A lot of people have questions about the vaccine, who will get it and when, and how it will be distributed in Oswego County. We've been told that the Pfizer vaccine is going first to large hospitals in New York State. Here in Oswego County, the County Health Department will receive the vaccine from the state, redistribute it, and vaccinate the general public. So far, the vaccine is for people ages 18 and older only. It does not include school-age children, and it will take months to get all adult populations covered. We'll of course keep everyone informed when the vaccine becomes available to county residents. Sonia Robinson is here today from the Health Department to share more information about the spread of COVID-19.
Thank you, Chairman Weatherup. Yesterday, the statement positivity rate was 5.2%, and here in Oswego County, it is 6.6%. That's down a little bit from last week. However, COVID-19 is still spreading at an alarming rate. It took Oswego County 6 months to get to 300 cases in the beginning of this pandemic, and we now are at a point when our county has 300 new cases of COVID-19 every 6 days or less. That is 300 new neighbors, co-workers, and loved ones in our small rural community affected by this pandemic. As of this afternoon, we have a total test number of 93,107. Total positive cases of 2,767. Total active positive cases, 597. Total released patients, 2,164. Deaths related to COVID-19 are at 19. Total negative results are 89,757. Our investigations show the virus is mostly being brought into a home by one member of the household and spreading in the home. We are seeing numerous clusters of cases among family members who live in different households. We know it is so difficult this time of year, but it is not safe for different households to get together, even if they are from the same family. This includes dinners, birthday parties, kids' sleepovers, and holiday parties. If you are tested for COVID-19, please remain quarantined until you receive your test results and are contacted by the County Health Department with instructions. You may receive your test results before the Health Department receives the results. We are working through the backlog of patients. People in quarantine should stay home, separate themselves from others, and monitor their health for symptoms of COVID-19. Getting a negative test result does not absolve you of your responsibility to quarantine if you've been ordered to quarantine. Stay home for 14 days after your last contact with a person who has COVID-19. Those who have tested positive need to stay home and isolate from others in the household. This means separating yourself in a room that is not shared with others. Always stay 6 feet away from others. Use a separate bathroom if possible, and disinfect it after each use. Wear a face mask if you must be around others, and wash your hands frequently. Thank you.
Thank you, Sonia. Please rely on accurate sources of information about the COVID pandemic. The Health Department's hotline is open Monday through Friday from 8:30 a.m. to 5 p.m., Saturday and Sundays from 9 a.m. to 1 p.m. The number to call is 315-349-3330. The more steps you take, the better you are protected against COVID-19. Wear a mask, stay at least 6 foot apart, avoid crowds, and wash your hands often. Thank you for doing your part.